And welcome back. Like we mentioned before the break, Dr. Christie Alexander from FSU's College of Medicine is back to answer more of our COVID-related questions.
All right, Dr. Alexander, thanks so much for joining us again today. How are you doing?
Doing well, thank you.
All right, glad to have you. We're going to jump right in here. Florida's case numbers continue to tick up by thousands every day. Here in Leon County, we're fast approaching 3,000 COVID cases, more than 70 people hospitalized here right now. What are you hearing from your colleagues here and across the state?
Definitely concerned for running out of hospital beds. I think you guys have probably heard about that as well. The case count across our entire state is over 20,000 hospitalizations at this point, and just having enough beds to keep up. And the thing about that is there's more than just COVID that people are hospitalized for, which is why we're so concerned about running out of beds, having enough beds for those with COVID and those without COVID that need those beds. So it is concerning, and we're all keeping our eyes on it very, very closely.
There's a new report from the CDC on the 3 symptoms that almost all COVID patients have. Could you break those down for us?
Absolutely. So the CDC did a small study of 164 people that were diagnosed with the coronavirus between January 14th and April 4th and looked at the consistency of symptoms amongst those 164 people. And 96% of them had either fever, cough, or shortness of breath, which were the first 3 symptoms we knew about that were associated with COVID-19, and 45% had all 3. So even though we know there are other symptoms of COVID, including headaches and malaise, just not feeling well, loss of taste and smell, nausea, vomiting, diarrhea, those things that we're seeing in younger people, the fever, cough, and shortness of breath are still the most predominant symptoms of coronavirus.
Okay, and we are seeing more and more mask requirements, including at stores like Walmart and Publix. A viewer reached out to us to ask if you could show us how to properly wear a mask, because she says she keeps seeing people who don't have it covering their nose.
Absolutely, my pleasure. This is something that I think deserves revisiting, because I agree. A lot of people just don't know how to wear one. I have 2 masks here, a cloth mask and a surgical mask, and they are applied the same way. The first thing you want to do is wash your hands for 20 seconds with soap and water or with hand sanitizer. And when you pick up your mask, pick it up from the elastic bands before you put it on. Try not to touch the face of the mask itself. When you put it on, put it over your ears and then stretch it over your nose and chin, like so. Now you can, and then you can see. So it's a little muffled right now, but you can see that the mask is completely covering my face. If you have it like this, if you have it just below your nose, and you sneeze, you risk respiratory droplets escaping from your nose onto someone else. Also, if you don't have it covering your nose completely or your chin completely, you may not be infected, but somebody who is coughs or sneezes near you, those respiratory droplets can go up your nose or under the mask into your mouth. Now, as you take the mask off, you want to take it off by those elastic bands, not touching the face of it, because if somebody has coughed or sneezed around you, that mask is contaminated. If it's a cloth mask, you want to be sure to wash it once a day and change it if it gets wet or sweaty, especially as hot as it is out here. So those are the guidelines, and then after you take your mask off, wash your hands again with soap and water or with hand sanitizer. So it's all about just using those elastic bands and making sure that your nose and your chin are completely covered while wearing it.
Stories and talked about people accessorizing with their mask and making sure that it, is nice to look at too. And you have a pretty pink one there, Dr. Alexander. So we appreciate that. Okay. As you get your earpiece back in, can you hear us again?
Yes. I
Okay,
can.
perfect.
Thank
She's
you.
back.
The masks don't really go well with the
Right?
earpiece.
Sometimes
I'm
they
back.
can rip it
You know,
off.
it's tough to juggle all that.
We were just complimenting you on your pink face mask that you have there.
Oh, thank you. Yeah.
All right, staying on the topic of masks, the head of the CDC says if we all wear masks, we could get this thing under control relatively quickly. Do you believe that's true?
So yes, the head of the CDC did say that if we were to all wear masks consistently for 4 to 8 weeks, I know that's sort of a broader guideline, 4, 6, 8 weeks, that we could contain the virus. It's not going to go away completely, but we can contain the surge that we're seeing, because that's how we know it's transmitted, is through those respiratory droplets. And there's so many people that are asymptomatic out there. It's not their fault that they don't know they're transmitting it, but wearing a mask would keep that transmission to a minimum. And then if you are standing near someone who's asymptomatic, it'll keep you from getting sick as well. So I do agree that a consistent wearing of masks for a consistent period of time will definitely help bring our numbers down. Again, the virus won't go away, but it'll be really, really helpful with containment, so that our hospitals don't get overrun, and that so that we can contain the number of deaths that are happening due to coronavirus.
All right, Dr. Alexander, as always, before you go, is there anything else that you would like to add today?
I just thank you guys so much for giving me the opportunity to demonstrate that. I think it's very, very helpful as a reminder to everyone in the community how to wear a mask and why it's so important to wear a mask. And we know it's super hot out there, but keep on doing so, because as I just said, if we all did it, if we were all consistently doing it, we could reduce the number of cases and reduce the number of deaths in our country dramatically.
All right, Dr. Alexander, thank you so much for your time today.
Thank you.